Well, hello everyone. I'm sorry for the delay in getting started. We're still sort of resolving a few technology issues, but we might get started just in the interest of everyone's time. The Lord Mayor of the City of Adelaide and the Chair of the Capital City Committee of Lord Mayors, Sandy Verschoor, is just having a few troubles getting logged on. But we've got Minister Luke Howarth on the call, and we've got a number of representatives from state and territory government. So we might just get going. So to start with, can I say that my name is David Pearson. I'm the CEO of the Australian Alliance to Homelessness, and thank you very much for joining us today as part of this third in our series of rough sleeping responses to COVID-19. We're really lucky to have such a broad representation of governments from across Australia on the call today. Can I start by acknowledging that we all meet on Aboriginal land and that pay our respects to elders past, present and future who may be on the call, and the fact that we do meet on a very diverse number of places across this wonderful country. I can see that we've got almost 200 people on the call at the moment, and that keeps ticking up as we've been waiting for a few of our last speakers to join. So acknowledgement to the Indigenous brothers and sisters who may be on the call. I guess I just wanted to make a few quick acknowledgements also as well. Today, you may not be aware, is the International Day recognising the contribution of nurses around the world, International Nurses Day, and that's obviously an important recognition today, given that the problem of rough sleeping homelessness is as much a health issue as it is a housing issue. A really important part of the work that we do is driven by the nurses, both in the health system but in the community services sector as well. So I just wanted to acknowledge all the nurses out there today and the work that they're doing. A really important group of people today. But I also wanted to acknowledge, before we start jumping into the details of this forum, that it is pretty extraordinary. We're all on this Zoom call, we're having a few technology issues, all those sorts of things, but this is a rapidly different world to what we had a few months ago. And I think we should just take a moment to acknowledge how much change has happened, how much a massive amount of work has been going. And I wanted to share this photo of our Chief Public Health Officer explaining what's going on in Australia at the moment, but something I think that we should be rightly proud of when you turn on the news and look around the world about what's going on with this virus and this pandemic. We have done an extraordinary thing in this country. All levels of government, all parts of society working to flatten this curve. We are now talking about the challenges we need to make sure that we don't have future waves of this virus and those sorts of things. And so to be talking about rough sleeping today is so incredibly important, because in making sure we have a sustainable response to the challenge of homelessness and rough sleeping particularly will be an incredibly important part of the response to this pandemic. So big acknowledgement of the massive amount of work that's been done generally, but particularly as well in relation to homelessness. I know there are a lot of people on this call who have been working extraordinarily long hours and who were on the very front line of this coronavirus pandemic from day one and continue to be. So a big acknowledgement of all of the effort of everyone involved in the collective work we're doing across Australia at the moment. And I think the massive achievement that we've all been able to make. So with that, the agenda for today is to talk a little bit about these issues. I'm going to say a few words about the Australian Alliance and our work. We've got an update from Paul Flatow, who will tell us a little about the latest data. So those of you who have been part of these previous forums, one of the things that we've been doing is trying to just get a sense of how many people have been sheltered in response to this virus. And there has been a phenomenal response. And Paul's going to share some of that with us. We'll have some reflections from Karen Walsh, who's the chair of the Australian Alliance to End Homelessness. And then we've got local, federal government and state and territory government's perspectives, with an opportunity to ask some questions throughout. So please feel free to pop the questions in the Q&A section when you are thinking or listening to people. Pop them in as we go. Someone's on hold. For us, that'd be great. Thank you. And yeah, please pop those questions in the Q&A section down the bottom of your screens as we go along, and we'll seek to answer those when we can during the session, but also with the various government representatives. So with that, I might just jump straight into it. So I guess we wanted to just say very briefly a little bit about the Australian Alliance. We're an organisation that has come together with a number of different organisations across Australia who are really committed to tackling the problem of street homelessness. We don't think that the challenge of rough sleeping, is something that's insurmountable. In fact, the scale of this challenge of street homelessness is something that is endable. It's something that we don't need to continue to accept as a normal thing. Of course, poverty and all forms of homelessness exist in Australia and will do for some time, but there are a growing number of communities around the world who are tackling the problem of street homelessness and doing it in a way that's focused on ending it. And a growing number of communities, I say, have achieved that goal, an end to rough sleeping homelessness. And the way we define that is that rough sleeping should be rare, brief, and non-reoccurring. That is, that it's a one-time thing. That is the standard that many other communities have set for themselves and they have achieved. And that is the standard we're trying as the Australian Alliance to help as many communities as possible across Australia to reach. And it is a reachable target. If this corona pandemic has shown anything, is that rapid progress is possible on that goal in short periods of time. And so massive amount of progress has been made, as I was saying, and we've done that through a range of different campaigns of support, which you aren't familiar with any of these campaigns. There's communities, I'd encourage you to look into them and get involved in your local community, and of course we'd be happy to discuss that. And it's really around using this data-driven approach where we understand the names of needs of people who are sleeping rough in any particular community, something that's been incredibly important in responding to the coronavirus pandemic, by understanding those names and being able to shelter quickly. So that's a really quick overview of the work that the Australian Alliance does. I'm really excited to hand over now to Paul Flatow to give us a bit of an update about what's the latest numbers telling us about what we've been able to achieve in the last few weeks. Paul.
Thanks, David, and hello, everyone. It's good to be here. And as David said, we've been updating the numbers over the last month. So we're working with the Australian Alliance to End Homelessness and looking at those who have received temporary accommodation across Australia. And it's been an outstanding effort. It's been unbelievable, really, to see the numbers involved. So first thing that was done was that public health plans were put in place right across Australia with all of the different state governments and the Australian government being involved in that. And so we had public health plans put in place. The second thing that happened was the provision of temporary accommodation to rough sleepers and others who were homeless as well. And that temporary accommodation was primarily provided in motels and hotels and in other places. Now, just amongst the agencies that we're connected with, so this is not a total number for Australia, but the agencies that we're connected with in the Australian Alliance to End Homelessness, who have been largely on the front line of this. So we're talking about Nearby, Launch Housing, MICA projects, RUA, Uniting Care West, Salvation Army, these kinds of agencies. We've got a total of 2,050 rough sleepers that have been provided with temporary accommodation to date across Australia. Now, the total number is obviously going to be higher than that because it will include agencies that we're not connected with. And so we're going to be working with all the state and territory governments to try and get a total Australian figure on that. And we know that beyond the rough sleepers, several thousand possibly have also been provided with that temporary accommodation. So for example, in New South Wales, Launch Housing in Sydney, 320. Nearby in Sydney. Launch Housing in Victoria, 970 amongst their partners. Queensland with MICA projects, 380. South Australia with Nearby, 300, which virtually covers almost all of rough sleeping in Adelaide. And 75 in Western Australia and smaller numbers in other states and territories. So that's a huge effort across Australia. We do know that there will be additional factors at work. So that was existing rough sleepers. We will probably be seeing fairly soon those who are newly homeless come into the system. And so we need to look at that group as well. Coming from economic contraction. There's also been issues around family domestic violence, and women's refuges are reporting on that, and as well, connected to that in the main, youth homelessness. Now, when we look at that number, 2,050, and we ask the question, what could we do? I mean, given that we did so much with temporary accommodation, what would a program look like if we were to provide permanent housing pretty well immediately into a housing market which has or will have in the next few months likely to have significant vacancy rates in the private rental market. So if you do something like this, a rental subsidy, including Commonwealth rent assistance and other rent subsidies to the person, to the landlord, around about 180 per week. If you then provide support to agencies, which is case management support, and if you also include community housing tenancy management with head leasing, you're looking at a figure of 380 per week per person and a total program figure of 40 million. Now, that figure of 40 million per year sounds relatively large, but then you are really addressing very significantly rough sleeping in Australia. And across all our research and across all our evaluations, whether it's the 50 Lives, 50 Homes in Perth, Biker Project's work, the Journey to Social Inclusion in Melbourne, Misha going back to the First Housing First program that we worked on in Sydney, you're looking at significant savings plus improved lives and reduced mental health issues, improved quality of life, links to employment. And when we look at that, those programs in the main have resulted in net savings. So that 40 million spend could be reversed into a net saving to state and federal governments. So it's an incredible work that's been done. Congratulations to all of those agencies and to government supporting. And now let's move from there into long-term permanent housing and a significant reduction in rough sleeping. Thanks very much, David.
Great, thanks, Paul. And Paul, if you wouldn't mind, would you be able to paste those numbers, those that you just added up into the Q&A section? There's been a few questions, just ask people to hear those numbers again. But Karen, if you're able to unmute and if you're able to quickly share a few of your reflections on that and where you think we should be going next.
Hi, everybody. I think that the numbers Paul gave were a split that Paul worked out with rough sleeping and total numbers. And I think that right across Australia, we've all been working on supporting the most vulnerable in addressing public health directives because people cannot abide by these directives of social distancing, hand hygiene, you know, staying at home, which has been the message that all of Australia's been given if they don't have a home or a place to stay. So I think that I know for Queensland, in Brisbane, it's been over 734 single individuals and 67 families. And that contributes to a total as of the 6th of May, which was 1,500 around that figure anyway, across Queensland, including regional areas. So we know that we've both prevented rough sleeping from escalating and responded to the rough sleepers who were present at the time that the pandemic and the national emergency was declared. And I think, you know, we all know that housing is a key contribution to addressing the pandemic as well as addressing homelessness, and that we need to ensure that we continue to put housing at the forefront if we're going to continue to flatten the curve, because international experience is showing quite clearly that homeless populations are very vulnerable in community transmission, and that we need to make sure that we're not leaving people behind as the recovery period starts, so that we actually need a recovery plan that includes housing in order to address the pandemic and in order to address homelessness, which was, you know, really a crisis before the pandemic was declared. I think that whilst most people have been in short-term housing, it's really important to acknowledge that they're still living with enormous uncertainty, enormous anxiety, significant health issues, not just in relation to the pandemic, but trying to address their fears and concerns about the pandemic, as well as the poor health conditions that many live with. They've had significant disruption to all of their services that they've relied on, like all of Australians have, but in a much different way when they've been living on the street or overcrowded. We had many people who had to leave overcrowded households because they didn't meet the public health directives about how many people could be in a household. So I think in moving forward, it's so critical that there is a vulnerable person and homeless recovery plan that is really focused on ensuring that we can look at a long-term goal here, as well as contribute to ensuring that the curve is flattened and stays flattened. And I too would like to acknowledge all the nurses who have been part of our effort on this Nurses' Day, because it's been very important to have this intersection between health, housing and homelessness to respond to this pandemic. And I think that many people have just been getting on and doing it whilst watching and seeing how the overall pandemic results turn out. Thanks.
Good. Thank you, Karen, for that. Well, can I ask Sandy Verschoor, as the Lord Mayor of the City of Adelaide, but particularly for today in the context of the national conversation that we're having here, wondering if you could say a few words, Sandy, with your role in the work that the Council of Capital City Lord Mayors has been doing. So, Sandy.
Yeah, David, thank you. Look, I'm not going to go into what we all know, but of course homelessness is very much concentrated and most visible in Australia's capital cities, with rough sleepers in the parks, in the streets, in the doorways of businesses. And of course, we all have been monitoring this and know that it has been increasing more than we can ever look after. I guess from our perspective as capital city Lord Mayors, we know that council plays a really significant role. We work very hard to be the catalyst of that community-led collaborative effort, and we've also been playing a really vital role in responding to the homelessness, both prior to and during COVID. I think what we've seen through COVID is that it's forced a huge number of innovations and adaptations in every sector. And the response to homelessness has been something that was both rapid and is something that collectively we're getting a nationwide view so we can see what worked, what hasn't, and give us a new understanding of what's possible. And we're using this evidence in terms of our advocacy work for both federal and state governments in terms of how we continue to respond to homelessness. It gives us really great knowledge to inform that future advocacy. We, like you, we absolutely don't want to return to an old norm. We've been able to achieve so much in such a short space of time. And like you, we, as capital city Lord Mayors, we believe that it's every Australian's right to have safe, appropriate, affordable and sustainable housing that is not up for debate. And we also understand that this is a systemic problem in terms of failing health systems, increased costs, New Start, which is below the poverty line, and also the infrastructure investment that has just not kept up with demand. So a lot of what we've been prosecuting at both state and federal level is really continuing to have that conversation in terms of, we all know what the answer is. We all know that housing first approach and investment in social housing is absolutely needed. It's a very simple solution to a very complex problem. But until we have the housing, we can't actually get those wraparound services. The Council of Capital City Lord Mayors actually did a pre-budget submission on housing and homelessness, and we called for an investment of about 200 million over a 4-year period. Excuse me. Oh, sorry. And that was for the development of a capital city housing first fund. It was to generate up to 2,000 tailored housing units for people sleeping rough or at risk of homelessness across the capital cities. And when you pair that, of course, with the support services, then we know that we can actually help address the underlying issues of homelessness, as well as we just know it's the right thing to do. It's the right thing socially, economically, but it is the right thing to do. And I think this post-COVID national response gives us the perfect opportunity to do what is right. We are continuing with, we've met several times with the Assistant Minister, Luke Howarth, and also with senators. We've met with our state government representative. We've spoken to Minister Lenzink, who co-chairs the advisory for the Adelaide Zero project here in Adelaide, and the Premier. So each of the capital city Lord Mayors is prosecuting their case for this to be the moment in time where we do the right thing, both by our cities and our states and our nation, but that there is a fundamental shift in terms of infrastructure investment, and that investment has to go into social housing. In terms of Adelaide, I'm just looking at the data here. I think the last time I looked was 313 people had been accommodated in 23 hotels and motels across Adelaide. And so the focus has actually now switched to finding long-term housing outcomes so that there is not a return to rough sleeping. And the state government has committed here that this is a priority for them. The key driver of the Adelaide Zero project, which is the by name list, has been such a valuable tool in providing a really targeted and individually tailored person-centred approach to supporting the people that were placed into the hotels and motels. And as best we can, we've been able to help with the services. It's been an incredible outcome for us, and the service providers have been able to get to the people that they need to, and we're really hoping that even that in and of itself is going to have significant outcomes for here in Adelaide. David, that's probably all I need to say, other than we are continuing to meet at federal level as the CCCLM. We're continuing to advocate for a Capital City Housing First Fund. We have each identified shovel-ready investments in each of our states that would give us some of that housing that we desperately need. And we'll continue to prosecute that case.
Great, thank you, Lord Mayor, and thank you for that summary and for your advocacy. That's great. Okay, well, our next speaker obviously needs a little introduction, but is the Commonwealth Minister for Assistant Minister for Community Housing, Homelessness and Community Services. So, Luke Howarth, thank you very much for joining us, and I'm wondering if you'd be willing to say a few words about your perspective on the responses to COVID-19 and homelessness.
Sure. Well, thank you very much, David. High quality service delivery and access to safe and secure housing for all Australians is obviously a critical issue. And I do want to thank you and everyone on the call for the opportunity to be part of this forum, but also for all the work that everyone on this call has been doing since this crisis started and well before. My key focus is reducing the incidence of homelessness and safe and secure housing, and housing first, because we know this leads to better health, education and safety outcomes, and workforce participation and choices in the bridge to recovery. I'm asking all states and territories to work in partnership with the Commonwealth as emergency relief, food relief, charities and community support services experience unprecedented challenges. Obviously, ensuring these essential services continue to be available for Australians, their families and across the country, that is our goal. Federal, state, territory and local governments are working together, and I've been really heartened by what I've seen and heard, not just on this call so far, but right through all my meetings over the last couple of months. States have responded quickly to what is needed for housing and homelessness services during this unprecedented time. And I've been working closely with states who obviously are responsible for the provision of the day-to-day housing and homelessness operations. And each state and territory has adapted practices and strategies most appropriate for their specific circumstances. Obviously, at every point of contact, governments are listening to the medical experts and working hand in hand through the National Cabinet to coordinate actions. People in urgent need of housing being temporarily housed, as we heard from Karen before, and also Paul, is making a huge difference right across Australia and through local communities. I know my own local community up in Queensland, a lot of work has been done there with Micah and Encircle and other groups that are working up there. In New South Wales, more than 2,000 people alone have been housed, and more in Victoria and right across the nation. We just heard from the Lord Mayor as well in Adelaide there about what's happening in South Australia. So your sector is shaping how we go about this response. And once again, thank you. The local councils have mixed and diverse responsibilities and have a key role in supporting effective service delivery and supporting reducing homelessness and housing outcomes. I've seen a commitment to expanding models that give communities a real say as in their part to local solutions as well. Effective engagement, growth, community confidence and capabilities to tackle complex issues, and high quality services underpin the well-being of the communities. Obviously, the federal government recognises a significant contribution frontline organisations like all of you here on this call make in supporting people experiencing or at risk of homelessness. And since we last met, work has been undertaken across governments to clarify advice on coronavirus and homelessness. National Cabinet has agreed that Safe Work Australia would be a single source of information to support organisations to plan with confidence and consistency to ensure they have a COVID-safe workplace. And you also asked me last time to look into PPE availability at this critical time. The National Medical Stockpile is for use in a national response to public health emergency and supplements state and territory health authority stockpiles. Pre-COVID, it seemed like that was a huge stockpile, but obviously that went fairly quickly. And I know the Health Minister, Greg Hunt, has been doing everything he can to bring more in and secure local manufacturing in different states as well. And it's been good to see some local manufacturers change what they do and quickly manufacture new PPE. I'm also facilitating connections to support organisations to source PPE from commercial providers, and this remains a focus. And as I draw on you to understand what is important to the sector and consult across governments, I take the time needed because we're bringing more people into the process and raising awareness of the vital work you do. This has certainly highlighted the work that you do. And it's also seen, I think, local members, both state and federal and councillors work together in a non-partisan way to try and help the homeless because of in conjunction with what you are doing. Obviously, the point I want to get across to everyone on the call is that if it matters to you, it matters to me because you are experts in what you're doing and supporting you with information necessary. A workforce on the front line of this crisis, I will remain committed to the task, just like the Australian athletes that have been set back that were due to go to Japan this year and now have to train for another 12 months to get Olympic success in 2021. In the face of this crisis, initial actions have been successful at slowing the growth, obviously, domestically. And we know that Australia is the envy of the world and other countries like Taiwan, where we've had a really, really low infection rate. We've had a low death rate. We've had high testing rates. But I know what the Prime Minister, Scott Morrison, is saying. In order to be a success, we need to maintain that great health outcome, as well as get all those, so many new people that have gone on to JobSeeker that have lost their job through the closing of the economy. That needs to obviously open back up in a timely manner in conjunction with the National Cabinet, but also maintain the great health record we've got to date. The Commonwealth has also invested over $320 billion to keep Australians in jobs, keep businesses in business, support households and keep investment flowing, including temporary assistance to people whose income is affected by a coronavirus through the social security system. And you'd all be well aware of the, some $140 billion plus for job keeper payments, as well as job seeker payments. There's 200 million, obviously, in emergency and food relief, and 150 million for families and domestic violence services, including safe and secure housing. As a nation, as we take the next steps, obviously with a clear plan that shows Australians the road ahead, the government remains committed to working across the housing spectrum to improve outcomes, particularly to those most in need. And the feedback that I received from you and will receive on this call today, I feed up to other ministers as well, the Minister for Social Services, the Minister for Housing, the Minister for Indigenous Affairs, and obviously the Prime Minister as well. Obviously, look, I won't go into more of what I've got here because I know there's other speakers and there's more questions, but I just want to say, as the First Assistant Minister for Homelessness and Community Housing in our nation's history, I'll be doing everything I can to support the expert feedback I receive from you and pass it up the food chain. I'll leave it at that.
Thank you, Minister. That's great. And can I encourage people listening in today, if they have questions for the Minister, questions for Lord Mayor, please pop them in the Q&A section and we'll answer them as best we can. So we've got a bit of time for questions now, and then we'll go to the states and territories, and then we'll have whatever time we've got left on today's call to take some more questions after that. But if I might start with you, Minister, and we'll wait, there's a few questions coming through, but are you able to elaborate, I guess, a bit on the health advice that the Commonwealth, you said, has been clarified about how that can be clearly shared with the sector, and what that advice is telling us about how the role of tackling homelessness plays in helping us to keep the curve flattened and to avoid further outbreaks, that sort of thing, as part of this COVID-19 response?
Yeah, well, look, I might be able to ask, our health officials, perhaps even Minister Hunt, to come on a call at some time and address that, at the next meeting. But obviously, given the fact that social distancing will be around for a long time, those homelessness sectors, particularly where there's overcrowded households, boarding houses, and in some cases even emergency accommodation, will need support there, because overcrowded situations and boarding houses don't lend themselves to social distancing. But perhaps I can get David some Commonwealth health officials on at the next meeting, if that's okay.
Yeah, that'd be great. I think that's something that's on the mind of a lot of people. That Karen mentioned this before about how do people socially isolate when they don't have housing, and what's the broader public health response about this going to be. So I've just got a question here from Deb Zanella. Minister, it'd be good for the government to recognise the cost savings that are made to health justice when we permanently house people in a COVID or non-COVID environment. Will the government make the investment of dollars in such a way, and what would in such a way that a large-scale impact both to housing supply and to the costs of support dollars, that sort of thing? So that it's kind of,
Yeah, I mean, look, I support a housing first approach myself personally, from what I've seen, and so I understand and took on notice what Professor Paul was saying before in relation to cost savings in other sectors, and it's something that I'm trying to advocate for in all my conversations with state governments as well. It's not an easy thing to do, given that when we look at our own homelessness figures and we look at emergency accommodation, boarding houses that make up a fair amount of the homelessness sector, they don't lend themselves in particular to tenure and privacy. And if we could get those things right, that would actually move people out of homelessness. And I've been putting those conversations forward. So I'm all for housing first, and for the cost savings associated with that. I guess it's just not an easy thing to turn around, but it's something that I am talking to other ministers about at the moment.
Yeah, great. It's very positive to hear the commitment to housing first principles. So there's a bit of a theme coming through with some of the questions at the moment, which is really about, Minister, what's the view from the Commonwealth about infrastructure investment for more social housing effectively? That we just need additional dollars, that there's a lot of consensus, I guess, amongst some of the questions that are coming through, but from sector about additional support dollars for that housing. What's your kind of perspective on that one?
Yeah, look, I do agree. As the Lord Mayor of South Australia was saying before, that a housing first approach and new social housing is needed. I absolutely agree that. Obviously, at the moment, the federal government throws about $6 billion a year in through the National Housing and Homelessness Agreement to the states, over $1.6 billion, and then another $4.5 billion a year in Commonwealth rent assistance, which is important. Then, of course, we have other programs like regional and remote housing, which particularly has a focus on Indigenous Australians. I've heard and spoken with the Lord Mayors, particularly like some of the proposals. There was a particular proposal from Lord Mayor Sally Capp down in Melbourne that I was particularly keen on and have been advocating for. Now, some of those things haven't been approved from the federal government at the moment. You know, they didn't get through the ERC, but they're things that I continue to talk to other ministers about. There, of course, states, I've been heartened too by state governments that obviously have prime responsibility here, that they have found a whole lot of money to help rough sleepers in particular. And the response after coronavirus, as the economy opens back up, as to where those people go will be important. And I'll be having that at the front of my mind in all of my discussions with state housing ministers and federal ministers here.
Great, thank you. We have a question from Michelle Welsh, who says that if we need to address homelessness, we need to address poverty. Government transition, its initial response from COVID-19 through to reducing poverty through the payment of Centrelink payments. So particularly the issue of the job seeker payment and how that's been temporarily increased. I think that there's a large amount of concern about if we revert back to the pre-COVID levels of New Start, that will throw a lot of people into poverty and to drive up the numbers of homelessness. Is there any chances of getting that payment extended or, you know, included done in a way that helps prevent further homelessness?
Yeah, look, you're right. There has been, during this crisis, a huge response from the Commonwealth in relation to the coronavirus supplement of $550 a fortnight, in addition to a recipient's regular income support payment. There's also been the $750 economic support payments in April, and then in July, job seeker, of course. So there's been billions and billions of dollars going out. It's not obviously my portfolio in the sense that I don't make the decision on that, but I think it would be wrong of me to say that the coronavirus supplement obviously is there during this coronavirus crisis. And so when the coronavirus is over, I'm pretty confident that coronavirus supplement will be removed. But in saying that to everyone on the line, that doesn't mean that the minister responsible won't look at other alternatives. So I don't want to, I certainly don't want to put out there that the coronavirus supplement would be maintained, because in my opinion, it won't be. But let's wait and see what happens. We've got, quite a few months yet before that happens anyway. But on the upside, the payments that are in place and everything that state and territory governments and local councils are doing, and the work that all of you are doing is having a big impact on the ground. And obviously, I want to make sure that those people are looked after, and we continue to offer all the support we can.
Great. Thank you, Minister. I mean, Sandy Verschoor, we've had a couple of questions about local government and their role, about what roles can local governments take to help address this crisis in a bigger way. You spoke a little bit about advocacy before. Is there any other thoughts you might want to add to that?
Well, in South Australia, I guess what we've tried to do is really invest in well, we've invested in the Adelaide Zero project, which you're very familiar with, David, and also to really have a coordinator role and an advocacy role across the sector with service providers and also with state government. I mean, it's interesting for me that the capital cities all have teams that are working with vulnerable people and people that are homeless and rough sleepers. And those teams have also been meeting nationally on a weekly basis through this whole crisis to make sure that we've got coordinated approaches, that we can sort of work with the state governments, facilitate whatever we need to. And, you know, it is more effective, obviously, if all levels of government are working together to resolve this. My main concern is that, you know, we sort of, we all know that what it requires is a shift in thinking and a shift in investment. And we all know that the cost of someone being homeless and the cost of the services that provided and hospitals and everything else that, you know, I mean, I think the social bonds are a good way to go. I know that Robert Pradelin's on the line. So, you know, we do need to engage with our corporate sector. We need to find other solutions, but the primary thing we need is a significant investment in the infrastructure itself, which is the housing outcomes. And then we can sort of rejig the services and things that can actually get to those people.
All right. On the issue of the private sector, yeah, you're right. Robert Pradelin has asked a question here about, and probably if you wanted to add in more, Sandy, but particularly to you, Minister, what role the private sector and how the government is working with the private sector to have greater responses to rough sleeping and homelessness generally.
Yeah, that's for me, sorry.
Yeah, sorry. Yeah.
Yeah, look, Minister Sukkar, the Minister for Housing as well, is also doing a lot of work in that space. And my office has been talking to him. I've got nothing further to announce on that at the moment, but obviously the private sector will play an important role. I mean, in my travels around the country, you know, over the last 12 months, I guess, when I travel to places like Hobart, you know, one of the big issues down in Hobart is that the private sector houses down there in that city, a lot of them have been put into Airbnb, you know, so they're being short-term accommodation for tourists and so forth, and those regular rental houses aren't available, and that's caused a real housing crisis down there. Obviously, with coronavirus, that's all ended. There is no tourism at the moment going into Tassie. There's no international tourists coming in. The moratoriums that through the National Cabinet that have been put in place about not being able to evict tenants, and some state governments have brought in some good legislation around that, but not being able to evict tenants if you've suffered financial hardship and not being able to put up rent will all have an effect, I think, on the private sector in the short term, and may actually see rents fall, and may actually see some of those homes that were on Airbnb come back into the private rental market, which could actually help people looking for accommodation. But long term, there's obviously a lot of issues in the private market, obviously with NRAS units and so forth finishing up. We want to continue to support the community housing sector outside of state governments. In my opinion, the not-for-profits there do a relatively good job and provide a good service. That's a continued conversation as well. There has been feedback as well. The government also does a lot of support for Verschoor deposit scheme, but there's also been feedback to me about you might have had one house, but it would be great to have a program for new people that are freshly separated, like a restart program. So all of these things I'm putting forward in discussions, not just with the Minister for Social Services, but the Minister for Housing as well. But to answer your question, the private sector needs to play an important part. I mean, state governments are not going to just build enough housing commission houses to help right around the country. And that's obviously why we also commit that $4.5 billion a year plus through the Commonwealth rent assistance to go into the private sector to help. Certainly that'll be a message that I'll be putting.
Good. Thank you, Minister. Apologies to people if the audio was cutting out there a little bit. Another kind of thing that comes through the questions here is rural Australia or rural and regional Australia about, is there a particular response that's needed there? And it may tie into what you were just talking then about private rental assistance and those sorts of things, that there's a group of people who are particularly vulnerable in regional Australia, and the services there are a lot thinner on the ground. What's the kind of Commonwealth's response to that, and how do we deal with that in the light of this current COVID crisis?
Look, in relation to rural Australia, I've mainly been focusing with the Minister for Indigenous Australia's Ken Wyatt on what the Commonwealth is doing through remote and regional housing, because in our homelessness figures in particular, places like the Northern Territory have, they have over 10% of homelessness in Australia, yet only a very small population. So that's mainly been my focus. But obviously, I haven't had a lot of feedback from rooms in the Australian Parliament further than what I just explained, but happy to hear feedback from everyone online.
Yeah, okay. I encourage, there's a number of people from rural areas in Australia at the moment on this call, so feel free to send some thoughts to the Minister on the chat and we can summarise those and send them through. Well, thank you, Lord Mayor and Minister, for that. I know that we've got a number of people from the states and territories, so run through those and I'd be keen to get your reflections on based on what each of those are saying shortly. So if we might, Minister Jaensch from Tasmania, I might hand over to you to say a few words, if you're happy to, about how the responses have been going in Tasmania and your perspective on that. So thank you.
Thank you, David, and hello, everybody, and thanks for the opportunity to participate today. I'll just give a quick rundown of some of the actions that we've taken here in Tasmania and some of the challenges we've still got ahead. First up, I suppose immediately in the first wave of responses that we announced, we recognised that there were a group of people who may be directed by public health authorities to self-isolate who weren't going to be able to because of their living arrangements. And so one of the first announcements made in Tasmania was for the set aside of a fund that would provide supervised hotel-style accommodation for those needing to self-isolate. And that's been running right through the crisis so far, alongside similar arrangements dedicated to supporting essential workers and returning Tasmanians, visitors required to quarantine, etc. But beyond that, very quickly a realisation that there was a whole lot of other people who were going to be unable to follow the more general public health guidelines regarding safe distancing and hygiene and mixing in public places because they had insecure accommodation. And so we decided to, in our raft of responses, go first to the scaling up of responses that we knew had worked and where there was knowledge and a workforce and experience and relationships and supply chains already in place that we could rapidly expand without a lag and lead time to get them up and running. And so off the back of that, the sorts of initiatives that we've invested in have been about, there's a rough sleeper program that's been operating in Hobart called the Safe Night Space, run by Hobart City Mission and the Salvation Army with assistance and support from the state government, but also Hobart City Council in one of their buildings, which was a overnight secure space for a relatively small number at a time, but a place where people could get a good night's sleep, get get a shower and a feed, and links to some services to assist them with housing and other supports. We've invested in that now to expand it to a 24/7 wraparound service in Hobart, but also in Launceston and Burnie on the northwest coast. So the Safe Space program is now a front door for rough sleepers. There's an outreach program associated with it to go find people who may need it, and more health, mental health, drug and alcohol, and housing support services connected to it, so we can move people from that overnight haven into longer term supported accommodation that meets their needs. We've also got a public health screening layer built into that, so that we're testing people and putting them through a little questionnaire regarding their exposure potentially to COVID-19. And then we offer a pathway to referral into health services and supervised quarantine as well for those with complex needs. We've also taken our brokerage program, which has been operating through our Housing Connect model statewide, and we've effectively made that uncapped, so that the partners who are delivering that emergency accommodation service, acquiring cabins, motel rooms, etc., have the capacity to secure longer term head rental of those sorts of properties wherever they're needed across the state. But we've also added to it a significant investment in access to mental health services for clients who are taken into those services as well, because we're recognising with the added traumas and anxieties associated with the coronavirus lockdown that that's going to be an important factor in the success of those brokered accommodation services. The third thing we've done is is to address a bit of an emerging issue that we had some research done on last year, which goes to the small but increasing numbers of younger people turning up to homelessness services, particularly unaccompanied under 16-year-olds who aren't necessarily registered as part of our child safety system, but for whom our existing shelters aren't well equipped, and we need to deal with them. So we've got now a task force that's provided us with some recommendations on how to respond to them, and we're setting up some cross-agency responses so that we can deal with those young people on an individual basis and see them through back either into a brokered or mediated home setting, into the child safety system if that's where they need to be able to go, or into some other form of supported holding pattern while we help them to sort out their lives. So that's an interesting and difficult new area of work where we've identified we need to put some extra resources, because there are some kids who are turning up in this who've got very ambiguous sort of governance or guardianship arrangements, but our shelters aren't set up for them. So these are all about how we bring more people in off the street and give them somewhere safe. All of this is shadowed in our investment in more longer term places for people to move into. If we're bringing them into shelters and into overnight secure accommodation, we need to be able to move them through. So at the moment we have new capacity opening up in our existing shelters, and we've brought in temporary accommodation in the form of converted shipping containers to expand a couple of major shelters, one for men, one for women with children in the Hobart area. We're converting a former popular watering hole, bottle shop and gaming venue into a supported accommodation facility. We purchased a hotel in North Hobart, and we're converting that to become a new supported accommodation facility. And we've brought forward a program of investment that we had over the next 3 to 4 years into the next 1 to 2 years to build new youth foyers and transitional accommodation in Hobart and Burnie in the northwest coast, and expand a couple of youth supported accommodation facilities and women's shelters in the north as well. We're building a new supported aged care facility for older Tasmanians who may be at risk of homelessness as well. And we have really been able to boost up our broader investment in social housing and bring some of that forward, partly to do with the agreement we struck with the Commonwealth to retire Tasmania's long-term Commonwealth state housing debt and convert it into an accelerated capital works program. So we're bringing more people in, but also investing in the ability to move them through into longer term accommodation that meets their needs. And the trick for us, even though our overall numbers are relatively small compared to bigger jurisdictions, is to get the whole spectrum covered, because when we talk about housing first, it's not one thing. It needs to be able to cater for youth, younger youth, older people, the different housing requirements of men and women with a need for supports, as well as the broader mainstream lower needs social housing waiting list clients. So housing first is, I think, a strong principle that's resonating well, but it's not one thing. It's many, many things. And we have, I think, always got to be looking at our program of investment and where the next unmet need is presenting itself, like with those younger people presenting at homeless shelters. So this work will never be all done, but we've got to keep learning, and I'm very glad to be part of this today so I can pick up some more tips on where we might need to be going next.
Great, thank you, Minister Jaensch. Appreciate that update from Tasmania, and great to hear that the new support coming online in terms of supported housing. That's always positive to hear. Okay, so to the Northern Territory, to the other end of the country, Karen Walsh, Karen with an E. Would you like to say what's going on in the Northern Territory?
Hi. Thanks very much for the opportunity to present today. I'm representing our Minister for Housing, Local Government and Community Development, the Honourable Jerry McCarthy. So I just thought I'd start with outlining the NT context, as it's been mentioned already about the differences in rural or regional communities. So some of the characteristics of the territory in terms of homelessness and rough sleepers are, we've actually got a population of 246,000. So that's just 1% of the, Australia's population. And about 50% of Territorians live outside of the Greater Darwin area across 4 regional towns. And we have about 73 remote communities and more than 500 homelands and outstations. And I can say for myself, I've only been working in the Territory for about 6 or 7 months. So I've certainly seen the very different environmental context here, and the challenges that are faced by, people within the not-for-profit and also government sectors in dealing with homelessness and rough sleeping. So whilst just 1% of the population residing in the Territory, we've got 12% of Australia's homeless population, and 88% of those are Aboriginal people. And incidentally, we only receive about 4.65% of the NAHA funding that's available for Australia. So specialist homelessness services in the Northern Territory, the data actually indicates that they're accessed at a much higher rate than Australia as a whole, and the number of people accessing services through that system has grown by about 50% in the last 7 years. Some of the other challenges that we have are to do with population mobility, particularly for Indigenous people between urban and remote parts of the territory, and that's so that people can frequent different towns for health, social services, or spiritual and ceremonial events. So the mobility issues going from remote to urban and urban to remote are some of the issues that we've been challenged with managing in this COVID space. We've also got, obviously, like everyone else, the issues of unmet demand and undersupply. Some of the specific issues that we've been dealing with since the health pandemic is things like hotel beds have become more costly in some areas, particularly Alice Springs. So that means if specialist homelessness services want to provide housing, particularly for women and children, they've actually got to pre-buy some of that bed space days or weeks in advance. And in Darwin, NGO service providers have actually identified around 280 rough sleepers, of whom about half have indicated a willingness to return to country, and the others haven't. So many of the people currently sleeping rough don't necessarily want to return to country, or are indeed unable to return for various reasons. So in the urban settings, it's been identified that people who may otherwise be homeless are visiting families or friends that are living in, particularly in social housing, which is contributing further to overcrowding, and in some cases has attributed to increased antisocial behaviour, which means we've got to actually be there ready to respond to that. As with other jurisdictions, the lack of PPE for frontline services and the challenge of delivering those services without adequate PPE at that time has impacted on service viability in certain areas. Another issue, particularly in remote communities, is one of food security. So, as I said, some people are returning to community, but they're actually finding themselves in a situation where the food is very unaffordable. So that's another issue that government has been challenged with responding to. So from an NT perspective about what we've actually done about this, we have operated on the principle of certainly looking after people who are most vulnerable and keeping Territorians safe. So our approach has been to support interagency and service coordination, about strengthening intergovernment relationships, working much more closely with the NGO and sectors and across government agencies. And we really have had to think on our feet like others have, I'm sure, and to innovate and to adapt and respond very quickly with very little additional funding available to do so. And we've certainly had to use the data, including anecdotal data from local areas, including from the NGOs and from peak bodies like NT Shelter, that have been partnering on some of those responses. So we certainly recognise that this is not a time where we will be able to solve homelessness, but we certainly can respond to it and mobilise the services and the assets within the service system to look at responding to the challenges that face us. We're continuing to deliver our build program in remote communities where we can, within the restrictions that are available and with permissions from land councils. So we're certainly wanting to, as much as possible, keep our supply program going. Funded services, that particularly the ones that we fund, we're working with them to maximise their service capacity, and they're certainly redeploying their staff to support other aspects of frontline service delivery. We've also stood up a specific homelessness team to identify a whole of government response to address the issues across the territory, targeting on the 5 regional centres. And we've sort of adopted a hub and spoke approach to high-level principles and outcomes, recognising that there are not particularly additional resources, but it's about mobilising the local networks and services and tapping into some of the identified capacity that's available. We've also, as others have, we've accelerated or fast-tracked some of our vacant property program to put them back into service as soon as possible. So that's about specifically responding to overcrowding and enabling people that are living in overcrowded conditions to move into some of those properties when they become available. One more point is the return to country program at a broader government level. So the territory's initial response to COVID-19 was certainly about assisting people to return to their safest, to return home, to the safest place within their communities. So an intensive return to country program was put in place during the first 2 weeks of March to assist community members to return home before restrictions came into place. And a not-for-profit provider in each regional centre was nominated to provide support through flights, buses, or paying for fuel to assist people to return to their communities. And to date, I think we've 2,200 people have accessed that return to country program, mostly Darwin and Alice Springs. So once the biosecurity legislation was enacted, we set up the appropriate facilities to support people, and the return to country quarantine program needed to ensure that those places were culturally appropriate so that people that were quarantined in those designated areas were actually able to go through that process with support from NGOs and others to make sure that there was a greater opportunity for success. A key component of that return to country process was the Centrelink services, and also preparing people for when they actually did return to community, that they actually had the supports in place rather than undertaking that when they got there. So as at the 7th of May, there are 181 people that have completed quarantine under the Return to Country program, and there's 134 people currently in quarantine. We certainly are continuing to work with the services, both in that program, but also across the homelessness service system to make sure that we, keep people safe, and also that we're addressing overcrowding and rough sleeping. I'd just like to, I think, take the opportunity now to thank, I need a glass of water, and recognise all of the work, in particular of the frontline workers, particularly the specialist homelessness services that have certainly, demonstrated their commitment to services and outcomes to clients during this time. So, yeah, that's about it from me. Thank you.
Karen, appreciate that. Just conscious of time, so Mark will jump straight into you. So Mark will Queensland Government.
Okay, thank you very much with that. And thanks everybody for the opportunity. I suppose I'd first like to reflect that the Queensland Government in 2017 established a housing strategy, a 10-year vision strategy, which looked at taking a holistic position about addressing housing issues in Queensland across a range of different accommodation types. And one of the key platforms of that was to recognise that housing was an essential service, and looking at improving the integration of housing homelessness responses more at that local level. And doing that, especially with working across sector representatives, one of the commitments there was to commit to housing specialist homeless services 5-year funding, which allowed an opportunity to be able to start talking more openly and more detailed around what are some of the best place-based service responses that we can provide, and help to develop up new products and services that can assist many of the people, women escaping domestic violence, homelessness, just for a few. And one of the aspects that last year we established across 9 key regions in Queensland was an integrated place-based response, which identified a lot of the homelessness hotspots that local community and people have been identifying, allowed for improving our partnerships across the sector and state agencies, and really started to get to focus on that support of individual solutions. I say this probably because of the fact that the work that was done, the great, building the relationships and having that honest and open conversations between agencies and the sector, has really greatly assisted in this pandemic health response, because it allowed us to establish quite quickly with key service providers and peak funded organisations and agencies to get first-hand knowledge of what were the issues facing them at that time when COVID started to hit quite dramatically. From that information that was provided, I think it was in about a week that Minister Brenny announced a $24.7 million immediate response package, which was there to try to address those issues that are being raised by the sector representatives, and again address many of those critical issues about additional brokerage, temporary accommodation, additional outreach services, and directed funding around Dignity First focus, which again was a special funding round to look at how those frontline services can assist while we're trying to get people under other accommodation. The department also freed up a lot of its sort of eligibility criteria, a lot of its old standard products and services, to make sure that they weren't an impediment for people being able to be service suitably housed. Many of the outreach services, as you know, we are still dealing with and are dealing with increased demand, and have been working tirelessly at the front line now for several weeks and months during this period of time, and seeing the homelessness response firsthand. So we established, as we do within many disasters, and Queensland's used to having disasters in different places with health and that regarding a housing response. In particular, that was about a housing, identifying the people's individual information solutions and being able to have that table and be able to work through on an individual basis. At the moment, we have about 1,500 odd people, or 1,600 people across Queensland that are in that space. Predominantly about half of those are in the Brisbane region, and sort of evenly placed around North Queensland, Central and out in the west. So each area where the Cairns is a different response and working with a different client group in some cases than what's happening in Brisbane. But again, being able to access this and have people working across teams, across department representatives, the housing and homelessness providers, and working on these longer term options, because whilst we put a lot of people obviously in temporary accommodation of hotels and motels, we all know that that's not a long-term sustainable solution for people, and that we have to be able to come up with more longer term solutions. One of the key focuses obviously in that is how do we get, and we're getting many of the families and children as quickly as possible into the social housing or private rental market properties where they can be settled quite quickly and as quickly as possible, so they're not having to move around. So in looking at these areas, we're also looking at some of our larger shared accommodation services that we've had, in particularly where COVID situation is more likely to be able to spread through community transmissions, where we have a lot of shared facilities. So the department leased a building of a student accommodation provider who obviously had a downturn in student accommodation with international students not being available, and who freed up that building to be able to, as we've decanted people out of those supported accommodation arrangements into that building, and being used by taking the specialist homeless services funding dollars and being able to just move that into managing differently. This is a fully self-contained apartment with support services on site. So it's one way of trying to look at what we can do something differently and continue jobs with people who were in that space before and providers, but being able to look at how we can reuse existing portfolios. We know that we're going to have to continue to work very closely around, taking this 1,500 and finding them longer term solutions. And some of them kind of have to happen, quicker than others because of, some of the hotels, depending on what happens and opens up, start to want to use those facilities again for something else. The department also continues with its job and construction program. We're still working fiercely to be able to get contracts in place with developers and builders and not-for-profits to be able to deliver, and still working to get funding through NIFIC and so forth for not-for-profits, so that we know that we've got a continued pipeline of construction coming through. This is in place, and obviously that will come when obviously further conversations will happen and discussions will be made around what other opportunities could happen in the social housing space in regarding construction future dates when governments be able to have that consideration. So we're mindful. We're in the middle of it. We know that we know more about where the people are and being able to work with them, but we've had to make sure that we provide support services for organisations who are working with the rough sleepers who are now in this temporary accommodation, and looking at opportunities that will come out of that, but looking at across the board using our community housing providers who have good relationships with private sector real estate agents through programs like our community rent scheme, and being able to try to make sure that how can we glean some more properties out of the system at the moment as we progress. So that's sort of where we're at the moment, and that we've still got a fair bit to do when it comes to making sure that we can get some good stable solutions for people in the shorter to longer term into next year.
Great. Thank you, Mark. That's what's going on. Some great work happening in Queensland. So we'll keep going through. So Sydney's from the West Australian Government. I have to say a few things about what's going over there.
Yeah, thank you. And thanks for the opportunity to talk to everybody. Just a bit of background on what's been happening in WA. Back in 2016, the WA Alliance to End Homelessness was formed, comprised of multiple organisations within WA. And that led to them developing the 10-year plan to end homelessness in Western Australia. Through extensive consultation, that plan was launched in April of 2018. The Department of Communities then worked really closely with the Alliance and then formed the state government's All Paths Lead to a Home, our WA 10-year strategy to end homelessness 2020 to 2030. The Alliance and communities, we continue to work together in partnership, and I just want to acknowledge John Berger, who heads up that work, on the strong work that he does do with the sector and with the department, working with us pretty much almost on a daily basis. And that the strategy has underpinned by 2 action plans, both 5-year plans. Within the first plan is the Housing First initiative, is 2 common ground facilities and a co-design on a no wrong door approach to homelessness. So working with the Alliance is an excellent example of how government can work with the community sector and a joined up approach as to what that strategy should look like. When we launched the WA strategy, the 10-year strategy, it was launched with a significant amount of state funding, which was fantastic, and that was launched in December last year. 34.5 million has gone into the Housing First homelessness initiative, and that will seek to house around 170 people over 5 years, supported into private rentals. It's really building on the 50 Lives, 50 Homes initiative that has been very successful and well evaluated here in WA. So it's really building on things that we already knew worked really well, and making sure that we can expand it through the broader community. This means for those who are playing at home in WA, areas such as Midland, Rockingham and Mandurah will be serviced, as well as regional locations of Bunbury and Geraldton, which is pretty exciting. So we're speeding this up because of COVID-19 as fast as we can. Certainly the approach that we thought in December, now the situation we're in sort of highlights that we need to move quicker. So the government is doing everything they can to see both the capital and the operational funding come through at a faster rate. So definitely got our foot on the pedal to do that. So really fundamentally, through the COVID-19 responses of government, it still has an eye to that long-term strategy that the state and the community sector has, acknowledging there's lots of things happening on the ground right now. Along with a homelessness strategy, there's also a WA housing strategy. We first came out with a housing strategy in 2010 for 10 years. This is the 2020 to 2030 strategy. And it builds on a lot of things that all the other states and others have spoken about, that it's not just a housing continuum that moves people from homelessness through to other accommodation or housing options, but it's also a support continuum. It's making sure that the right supports are wrapped around individuals and families to help them on the journey through more safe and stable accommodation and out of a vulnerable situation. We're also working on the No Wrong Door approach, which is a platform that really addresses people's housing needs as well, and really starts to get into a bit more of the data and analysis that we need to be able to make sure that we've got the right responses. COVID-19 has shone a light for us as government on what's been working but what hasn't been working. So I think there's a really great opportunity here to move forward with our already established partnerships with the sector to new ways of thinking, new ways of operating, new ways of investing. It also has, you know, as much as we've done very well, particularly here in WA from COVID-19, it doesn't take away the risk that there still could be cluster outbreaks. So a lot of work is being done on scenario planning. Should that happen, what would be our response collectively to do that? To help us work through scenario plannings and all of the COVID-19, the WA government has set up 9 task forces for vulnerable cohorts, and one of those task forces is the Homelessness Task Force, and has very much been focusing on the immediate issues of COVID-19 and how do we respond. Think about the scenarios, should we get a cluster outbreak, what would we do? But then think about the recovery plan. And we acknowledge that there's been lots of great work done by the federal government in Job Seeker and Job Keeper, but they're not sustainable longer term, and they will need to transition in some way. What happens to people when that happens? What happens when Job Keeper is scaled back? Where does that leave what we are seeing now as an emerging vulnerable homeless cohort? Do they look different? Do we need to change our service activity? And how does that actually reflect in various locations? Because we're not all the same, and you know, WA is a big state. So how do we stay person focused? How do we stay place based? How do we create place-led recovery? And how do we keep community connection in this time when everyone's feeling quite isolated? Under the housing strategy, we are also working through 3 plans that will be rolled out. One of them is the affordable housing plan. So it's about bringing in those affordable housing opportunities and social housing opportunities, but also a separate plan on remote and regional communities, because every one of our regions is different. All of their economies are different. The cohorts of people that are in the communities can be slightly different. And so we need that nuanced response that really thinks about what is the place-led, place-based needs of that community, because we're such a big state. We also work very closely with our private sector partners in WA, with a lot of our land developments that deliver us a lot of social housing outcomes. As part of the package that was announced last year, an additional 150 million was made available for 500 new social homes, and very targeted on the priority of homelessness in that. That's building on a $355 million package that was a housing and jobs package announced a couple of years ago. So really lots of investment coming through that pipeline. That's not only good because it's housing opportunities, it's also great because it's housing construction jobs, and it's one of the top workforce contributors in the state, and making sure that people have a job to then enable them to have a home is just as critical. So a lot of that funding is flowing through. We're trying to make sure that it's done as quickly as we can, particularly in this period where people have lost a lot of jobs, and we're seeing that unemployment rate rising. This we think will come and contribute to that. But is there more work to do? Yes, absolutely there is. So working with our sector partners all the way through, and what our new partnership model is going to look like for the future is something we're very focused on. How do we keep that place-led, community-focused recovery in place, but we also keep our eye on the ball to deal with COVID-19 should it have an outbreak in any one particular location.
Great, thank you very much, Stephanie. That's a lot to cover, but there's a lot going on. It's great to hear about some of the investments and the place-based focus in Western Australia. That's so important. We know that works. So Paul Veers from New South Wales, if you're on the line, hopefully you can hear us, and can you share a few of your perspectives from what's going on in New South Wales?
Yes, I can. Can you hear me all right?
Yes.
Okay, so everything for us changed on the 1st of April when we decided to do everything we could conceivably do to assist people sleeping rough to get off the streets and into accommodation. Before the 1st of April, we had government housing staff doing street outreach in 3 locations, often with NGO partners. By later that week, we'd upped that to 41 locations across the state where we know there are rough sleepers. So sometimes just government staff, sometimes staff and NGOs. And in Sydney, where we've had housing staff and NGOs doing street outreach for a few years now, we and health partners have increased the number of daily patrols to 6. So 6 times a day we go out on the streets. At the same time, our specialist homelessness services were having to deconcentrate. So temporary accommodation in hotels and motels has absolutely become key for us. We also changed our policy that day to guarantee rough sleepers a minimum of 30 days in temporary accommodation, and that can be renewed if needed. For other types of homelessness, so people whose couch surfing, for example, has come to an end, we give them an initial 5 days and renew that where needed. So what's happened? We've had a total of 7,130 people come into temporary accommodation across the state since April the 1st. Of that number, we've accommodated 1,332 rough sleepers in temporary accommodation. I'll come on to how long people stay, but on a given night, we've got between 500 and 600 rough sleepers in our temporary accommodation across the state. The census says in New South Wales we have 2,600 rough sleepers, although the ABS does say that's an overestimate. But we have a massive opportunity here in that we've assisted almost half of all rough sleepers in the state. And in Sydney, going out 6 times a day means there's very, very few people left on the streets, and those are people who we are really, really struggling to engage with. Once someone comes into temporary accommodation, we establish contact with them by phone or in person in the larger Sydney hotels where we may have 40 or 50 people, where we run pop-up offices there. Across the whole state, we refer people to specialist homelessness services who've got a somewhat increased capacity. And we also offer people financial assistance into a private rental. Now, it is a sobering statistic that although we guarantee 30 days initially with the possibility of renewal, although we link people to support services and other forms of assistance, the average length of stay of a rough sleeper in our temporary accommodation is 17 days, which is less than almost half what we actually guarantee them initially. And we'd willingly offer them 60 or even 90 days if we needed to. Where we can, so these are people who are coming in for a couple of weeks and then making their own decision to leave against our advice. Where we can, we're helping people into social housing, but the numbers are really so great that that can only ever be a relatively small part of the solution. We've been given an increase in private rental subsidies, which is great because we're seeing rental prices drop by 30+%. Our focus now with our central agency is to see if we can get a large amount of 1- and 2-year leases to help us get people out of temporary accommodation and into something more stable where we can support them to a long-term solution. That's it from me.
Good day. Thank you, Paul. It's great to hear some of that update. Almost half the rough sleepers assisted. That's a state like New South Wales. That is a huge effort. So, thank you for that update. Paul Reardon, our last kind of state-based update from South Australia. You can give us a bit of an update.
Fantastic. Thanks, David. I'll be fairly quick given the time, but we put about 320 people into hotels and motels, primarily in the CBD area. We also had a significant population in the city of Adelaide of people from remote communities, and so we decided to create a camp arrangement in the Adelaide Hills, and we accommodated 50 from the APY lands primarily up there. We also recognised that we didn't have, and we still don't have, a return to country option for many of the remote visitors from communities because of the Security Act. And so we're just working through those issues now so that we can hopefully assist people back to their home. So getting people into the hotels and motels was really the easy bit. I think the more difficult bit is finding the accommodation that is more long-term. So through the Adelaide Zero project, we have created a subcommittee which will consist of the main specialist homelessness services of the state and also all of the major community housing organisations. And so the intent there is that we in the public housing system will work collaboratively with the sector and do everything we can to achieve an outcome for people. We also have obtained additional support dollars so that case management can be provided to the people that need it. So I think at this point in time, we're progressing quite well. There are some challenges, but relatively speaking for what we've done, they're pretty minor. And in fact, there's been some fantastic stories already emerging where people who have been rough sleeping for say 2 years, once they became accommodated, even in a motel, their situation improved dramatically. They were able to get things like mental health supports to them immediately, and you know their situation is.
Great, thank you, Paul. Sorry, I think there was just a bit of interference there from somewhere, but
There was. So we're seeing some really good stories, and I think the opportunity to talk with people who are in the same place and not moving around has really allowed the support programs to connect with them and really uncover what their needs might be and then help them through. And I think you know the real issue for us is that the number of allocations that we'll need to make into either the public housing or the community housing or even into private rental far exceeds our normal approach. In addition to the rough sleeper increases, we've also seen a dramatic growth in our emergency accommodation program, and that's from people from metropolitan areas of Adelaide, but also in regional centres. So right across the board, there's been a huge spike in demand, and that means a huge spike in terms of opportunities, if you like, for finding people long-term accommodation options. So that's the South Australian perspective.
great. Thank you very much, Paul. Look, thank you, everyone. I think we're probably a bit out of time for questions. We've covered a lot of ground. There's a lot of things going on all over the country. So thank you very much for everyone participating. I know there's a lot going on in everyone's lives at the moment. Please stay in touch with us as the Australian Alliance. We're hoping to launch at a summit later in the year in Brisbane, so we'd love for you all to think about coming to that. This campaign that we've been seeking to build over the last few years, and we have been building over the last few years, of communities who are committed to working together, to using the approach that we've been working on around data-driven approaches, the place-based, as our West Australian colleagues were talking about, to improve and end street homelessness. And we've made so much rapid progress in the last few months. There's more work to be done, but thank you all for your time today. Please stay in touch, as I say, and as we've been finishing some of these webinars recently, we are working really closely with other colleagues around the world. The Canadian Alliance in Homelessness, they finished off all their emails and events with a motivational message, and we've stolen one of theirs, that the task we're engaged in here is not going to be an easy one, but it will be worth it when we achieve it. So thank you for all the work you're doing. Never give up, and we will talk to you soon. Thanks for being part of today's forum.